Hello, I'm Dr. Jenny Andrus, and welcome to Joint Ventures. In this OSC original podcast, we take a look at current medical news and headlines. We know medical news can be dry, confusing, and even sometimes misleading. This podcast format gives us time to dive deep into the science as well as the controversies. Our goal is to review the latest medical news and trends in a non-biased way and present it in a format that's understandable. Welcome, and let me introduce myself. I'm an interventional pain management physician with Orthopedic and Spine Center in Newport News, Virginia. Since my practice is focused on musculoskeletal medicine, I frequently get questions about natural treatments for pain. As both patients and doctors become more concerned with the potential medication side effects that are out there, there's been an ever-increasing interest in these, quote, natural treatments. Patients are routinely asking me about supplements they've seen advertised for pain, inflammation, and arthritis. Now, let's be clear. Just because something is, quote, natural doesn't make it good or safe. Ebola, my friends, is natural. And have you seen some of the prices of those supplements and natural remedies? A lot of them are way more expensive than the copays on a generic medicine. So before you run to the health food store or you hit complete on that Amazon order, let's talk a bit about turmeric or curcumin extract. And is it worth all the hype? Well, let's start with the basics. What is turmeric anyway? I'm sad to say, but I'm not a big Indian food fan, and I don't think I've ever used it in a dish, so I wasn't really all that familiar with it myself. But turmeric is a spice from the ginger family and widely used in Asian food and Eastern medicine. Curcumin is one component and makes up 3 to 10% of the turmeric powder. Isolated curcumin extract is what has the anti-inflammatory properties that we're interested in. But why would we be interested in those anti-inflammatory properties anyway? Well, osteoarthritis is the most prevalent joint disease worldwide. 19% of Americans over age 45 have knee arthritis. Osteoarthritis is not just simply wear and tear, although age is the predominant cause. But we now know that mechanical factors like your joint use, body weight, inflammatory and metabolic factors, as well as genetics play a role. So this begs the question, what can we do about any of these risk factors? The only cure for birthdays is to stop having them, and we obviously don't want that. Our age isn't something we can change. We can't change our mom and dad. I got the arthritis gene, I know it. Our genetics are not modifiable. We can fix our weight, and we can make our muscles stronger, and that's a place where we can intervene, but what else? Any way to help with the inflammation. The current standard is anti-inflammatory drugs, steroids, or injections. But why would we want to get rid of the inflammation anyway? What does inflammation do to the joint? Well, initial loss of cartilage integrity allows for an increased susceptibility to damage from the physical impact. As the damage continues, chondrocyte activity, those are the cartilage cells that are important for the structure, function, and repair of joints, that increases, leading to secondary degradation and inflammation. That inflammation subsequently plays a role in the development of arthritis. Now, this level of inflammation isn't something you would necessarily see as a swollen joint or even feel as pain. Curcumin extract affects the signaling of pro-inflammatory cytokines, such as interleukins, phospholipase A2, and COX-2. This is similar to the action of NSAIDs. Curcumin's anti-inflammatory properties may be particularly important at the chondrocyte level, the cartilage cells, where curcumin has an inhibitory effect on macrophages, which are cells that break down that cartilage. So basically, curcumin has similar mechanism of action as NSAIDs, and theoretically could even be protective to the joint, cartilage. So, when deciding to take a supplement, your first question needs to be, what are the risks versus the benefits? Just like anything in medicine, we are looking at what are the potential benefits versus the downsides of either giving the treatment or withholding the treatment. So, is the treatment efficacious in either treating or preventing a problem? And if so, what are the downsides or the side effects of the treatment? Well, let's start with this burning question. Does this stuff actually help? Is there more than just a theoretical benefit? Let's go to the studies. What do they say? Before we get into the studies in great detail, it's important to note that there are several that are randomized controlled trials looking at curcumin in knee arthritis. Other joints have not been studied in the same way. And trials on rheumatoid arthritis, lupus, or other autoimmune arthropathies are definitely not as robust. Many of them are small and not randomized. Now, this doesn't mean that there isn't some valuable information there. However, we have to look at them in the context of what was actually studied. Now, when we are specifically talking about knee pain, a meta-analysis from 2021 showed some improvement in pain and improved physical function when curcumin is compared to placebo. Some studies showed a similar effect to two NSAIDs, diclofenac and ibuprofen. However, these NSAID doses were lower than what would be typically prescribed. Kind of interesting that they did that. Curcumin reduced the amount of NSAID and Tylenol needed when compared to placebo. These studies showed no significant adverse effects and suggested 12 weeks of use were needed to see benefit. This data supports that curcumin supplements do actually help with pain. In the knee arthritis studies, it appears to help with pain, stiffness, and improvement in joint function. It's better than placebo and may be as good as a low-dose NSAID. It has mild side effects, usually just mildly upset stomach or diarrhea. Now, we don't have an answer to if this actually prevents any further deterioration of the joint. The studies also did not typically do analysis based on the severity of knee arthritis, and they excluded very obese people. So we don't know how much this helps in the presence of obesity or in very severe versus early arthritis. The bioavailability of turmeric is low. That means that your body does not absorb much of it. So it requires sizable therapeutic doses to see effect. These studies could not determine optimal dosing. Also, most musculoskeletal doctors, me included, agree that some inflammation is necessary for healing after injury, even those little micro traumas you get from everyday life. So we don't want to get rid of that joint inflammation completely and rid it of its healing properties. That being said, curcumin sounds worth a try to me. So what's the next question? How do we take it, right? Well, curcumin 1,000 to 2,000 milligrams per day seems to be the general consensus for therapeutic dose. Supplements used in the studies were typically of really high quality and contained up to 95% curcumin. Brands using black pepper, phospholipids, antioxidants, and nanoparticles are better for bioavailability or absorption. Curcumin's hard for your body to absorb, and only 2 to 3% ends up in your bloodstream. To increase the absorption even more, take it with a meal where you consume some fat. Dietary sources are probably best, but it would be really difficult to get this amount into your diet without taking a supplement. Over-the-counter dietary supplements aren't tested and regulated the way prescription drugs are. So information regarding purity, strength, and other potential interactions with your medicines or other diseases is typically pretty limited. Be sure any curcumin supplement you take has been independently tested for authenticity and toxic metals by a third party. They usually advertise that. Curcumin is a mild blood thinner, so you need to talk to your doctor if you take a blood thinner like warfarin or Xarelto, if you have a bleeding disorder or you're planning on a surgery. It also may interact with some medicines like cyclosporin. So before you spend your money, just touch base with the prescribing doctor or with your pharmacist to be sure it's not something that's going to interact poorly with your medicines. Small studies outside of the U.S. have shown benefit in psoriasis, ulcerative colitis, and rheumatoid arthritis. Now, no, these benefits were not so dramatic as to replace prescription medicines, but it could be an exciting add-on treatment. I honestly did not expect to be as impressed by the data on turmeric as I actually have been. I now have been down the rabbit hole for you, my friends, and my phone and Google account are nothing but ads for turmeric supplements. It absolutely makes me miss the days of my BlackBerry, which I had for much longer than average, I confess, and my phone did not listen to me then. But honestly, I was impressed enough that I have some in my Amazon cart right now. So thank you so very much for listening. I hope you found this useful. We would love for you to subscribe to this podcast so you never miss out on new episodes. Thank you again, wishing you good health, and see you soon. Bye-bye.
At Orthopedic and Spine Center, we're dedicated to providing the highest quality treatment using the most advanced technology available. Our fellowship-trained spine and interventional pain management physicians specialize in diagnosing painful conditions and offer minimally invasive interventions to complex spine surgeries. Our pain psychologist helps patients understand and reduce stress from chronic pain conditions. Our experienced physicians get you back to doing what you love. Call today for an appointment. Experience excellence at Orthopedic and Spine Center.